India has one of the highest maternal death rates in the world, and the country's improvement targets are way off track. Health advocates say legal interventions can pick up the pace and save women from easily preventable death. But even after 63 years of independence, maternal mortality rate in India leaves a lot to be desired. In India, one woman dies from complications related to pregnancy and childbirth every 7 minutes. 1 million children born in India are dying every year, even before they become 28 days old. Moreover, avoidable complications during childbirth are killing 78,000 women in India every year. Isn't the state of India's pregnant women pathetic? This is what we'll try and analyze today as we talk about the State of the World's Mothers Report 2010. Welcome to Gender Discourse. I'm Lottie Alaric. To take this forward, I have in the studio an eminent panel of guests. It is my privilege to welcome Dr. Vijay Zutshi, who's a gynecologist at the Lok Nayak Hospital and Maulana Azad Medical College. Sitting to her right is Mr. P.K. Hota, who's the former Health Secretary of India. And to my left is Dr. Renu Singh, who's the director with the Save the Children. And I'm very happy that we are also joined by Vijay Lakshmi Nanda, who is from Delhi University and who has done a lot of research on female feticide. So I take this opportunity of welcoming all of you to the show. Well, before we actually get into the discussion, before I get my guests to tell us exactly what this report means and what is maternal mortality rate in the country, we'll try and take a look at this, the highlights of this report.
The State of the World's Mothers 2010. Save the Children released a report on the State of the World's Mothers 2010 on May 4th, 2010. Report was on access to education, economic opportunities, maternal and child health care. A total of 160 countries were analyzed for the best place to be a mother. Sweden remained at the top of the list, while Afghanistan ranked the last. India rated 73rd out of 77 middle-income countries. Mothers in Norway and Australia are living in the best places in the world, says the report. Global shortfall of 4.3 million healthcare workers needed to end preventable maternal and child deaths. Bureau Report, Lok Sabha Television.
Well, 73rd out of 77. So I think that figure is quite shameful. So I would like to start with you as you're a gynecologist as to what do you really make of this report?
Well, what we have been even seeing even of today, or if we go back and analyze our reports of maternal mortality sitting in a tertiary level center also. So we haven't really made much difference.
True.
Probably the reason is the type of women we are catering to in a government setup especially, because the bulk of the, I think around 70% to 80% are delivering in rural areas, and in urban slums, the ladies who are coming to the tertiary level centers in a government setup. So the problems faced are more or less same.
Right.
The timely reporting to the hospital, or sometimes even they don't have the transportation available. They keep waiting for the husbands or the mother-in-law to decide for them to be taken to the hospital, and by the time they really come to us, it's really too late. They are kind of an irreversible situation where howsoever hard we may try, we are not able to salvage them.
Right. So, Mr. Hota, don't you think that these kind of figures are actually appalling? I mean, talking about the state of the Indian woman, I mean, I would really like your reaction on this.
Ma'am, at the risk of my arithmetic, I must hasten to say that it's not 1 million. There are about 30 million births, 27 million plus other miscarriages, this, that. And births per year in India.
Right.
Which is a huge thing. In China, it's only 10 million per year. Of this, about 100,000 die. So, but that's not the issue. Even one life lost is a
absolutely,
loss.
absolutely.
Motherhood is not a disease. It's the responsibility of the state and the country and the society and everybody.
Right.
To stand by the mother, because she is the source of renewability of civilization. Sweden may be the best place for mothers to deliver. The mothers have refused to first get pregnant there. I'm talking in a global, larger sense, the baby rate. In our country, the situation was really bleak. In 2003, when I first joined the ministry, the figure was somewhere around 500 for 100,000 live births, and UP, etc., were the leading culprits.
Yes.
Now, I'm told, this is of course rumor, I have not seen it myself, it has come down, factually it has been released 254. And now the rumor is it is 182, the latest survey shows. So the miracle seems to be happening, but it is no place for comfort.
Absolutely.
In the same country, Kerala has reached about 70 or 80. We could easily go at the risk of all the generalization and simplification, and the resource constraint and the varied performance, and what ma'am said, my esteemed colleague, the tertiary level and the primary care and the tribal belt and the deprived woman. Yet, if we reorganize our resources and become determined, we could get the all India figure to below 100, which is the Millennium Development Goal. But to think that we will become Sweden overnight will take a lot of doing. There are traditional factors like nutrition and low age of marriage and repetitive pregnancy, etc.
All right. Well, for those of you who've just tuned in, this is Gender Discourse, and today we are talking about maternal mortality in the country. So people, if you have something to say in this regard, please call us. Our lines are open right now, and the number is 1800115313. That is 1800115313. Well, till our people actually think of calling us up, Renu, my next question is to you. That when, of course, this report has come out from Save the Children. Now, what really prompted you to go for this kind of a survey, and the figures are for everyone to see?
This is a global report. We have launched a child survival campaign last year across all the countries we work in. India is one of the focus countries, and this report is really a commentary on the state of mothers in the world. And we have developed a mothers index, just because you can't look at child survival without looking at mothers.
Absolutely.
So therefore, because the MDG 4 and 2 are so interlinked, we are trying to understand what is it. And I think what Mr. Hota just said, and Dr. Zuchi just said, that there are many factors like education, which impact maternal mortality, and sometimes those, we actually work in silos, we work in compartments across ministries, across policies, and there is a great need therefore to understand what is happening across the world and learn from the best practices. So this report is really to draw on some of the best practices and say what are applicable. All of them you may not be able to immediately expedite in your own country, but there are many things that we can.